Good afternoon, everyone. My name is Cassandra Taylor, the founder and CEO of Top Flight Defense Incorporated. We are here today with Artie Barnes from the Illinois Department of Public Health, and we're talking about immunizations and monkeypox. So without further ado, Artie, come on, talk to us and let us know what you got.
Great, and thank you for having me. I'm really honored to be able to present two women and also especially women who have served our country. So this is a double honor for me. I don't have, let me see if I can move my screen here. There you go. I don't have any disclosures, which means I don't get paid by any drug company or any interest in promoting any of the information I'm going to share with you today. So what are we going to talk about? We're going to talk about vaccinations and how they evolved, what they mean. And, you know, a lot of women, yes, we worry about ourselves, but more than ourselves, we care for everyone around us, including our children. So I'm going to talk about how to think about the importance of getting our children vaccinated. And then I'm going to go a little bit into COVID vaccinations and boosters and end with what's on everyone's mind, monkeypox. So if you think, you know, everyone's like, oh, vaccinations, they're new, we should might as well just get the disease. And we hear that a lot in the context, especially now in the past couple of years. But back when they first figured out how to even do vaccines, they were smallpox, and I bring smallpox up because that's the first vaccine ever discovered. And today we're dealing with monkeypox, which is a cousin of smallpox, very similar. The same vaccine works. The same vaccine works against it. 10 to 20% of the people died from it at that point. That's more than almost any disease that we know today. And how they found out is they would take small quantities of the infection itself and put it right under the skin, enough to cause a reaction, enough to make you a little sick, but not sick enough to really kill you. And that was a goal, not to not get you, infected, but to prevent you from really not making it from getting this disease. And so what has been going on since then? Since then, we've had so many vaccines. I'm going to take you to this guy. So back, the big epidemic or pandemic that occurred was in 1918, right? Flu, you heard it. I don't know if people have heard about the big flu pandemic. And at that time, we didn't even know what viruses were. So smallpox, again, we had the vaccine, which was a virus. We found out a way of like doing it without even knowing what it was, but it was not till like the 1930s that we even knew how to think about viruses. And then this is Dr. Salk. He came up with the first flu shot in the 1940s. And after that, right around that time, there's something that was also devastating a lot of people, especially in the US, and that was polio. And children were dying from it. If you have family members or anyone, even in older generations who had polio, you'll see that it can be really devastating. And so not only did he come out with the flu vaccine, he actually came up with the polio vaccine in the 1950s. And at that point in time, if I've heard so much about, oh, COVID vaccines are so experimental, we don't know about them, but think about this. This was like within a few years of even understanding that there's a virus or what viruses are, they're coming up with a vaccine back then, super experimental. And there was so much gratitude that finally the children and the households would actually have a shot of surviving, have a shot of being saved. And even the President Eisenhower broke down when crying, literally his voice was breaking down when he was so appreciative that there was a vaccine and that people could get vaccinated, Americans could get saved at that point in time. And it was still fraught with the same kind of issues, all vaccines face. There was a time they didn't even understand how to make sure these vaccines were stable, and they didn't keep them. The one batch of vaccine went bad, and children died because of the bad vaccination. And that's And yet they persisted because more children were saved when they were able to figure out how to do this right. And this is the guy who said, okay, I think I've got to figure out a better way of doing this. Is Dr. Sabin. And back in the 50s and 60s, there were Sabin Sundays where people would line up for miles trying to get their polio shot. And this first, again, polio vaccine, 1955. By 1979, 25 years later, 24 years later, we had eradicated polio from the US. And I say this now because I'm sure some of you have heard of the polio case in New York City. And that's because, again, we have a growing, while it's eliminated from the US, it's not eliminated from other countries. And we have a growing number of people who are unvaccinated who are still vulnerable to getting it. So fast forward, right? We're talking about women who really make the world change. This is Dr. Carrico. In 1990, she came up with a way of looking at something called mRNA. So this was some talking about, again, almost over 30 years ago, coming up with something called mRNA and how it can really be used to target things that we wanted to target. And at first she was thinking of targeting cancer, but she found out, we can target viruses too and use it as a vaccine. And this mRNA technology has been in development, refined by her and by her colleague. And this is both of them. Finally, they're getting the first in line to get the COVID shot. And this is in Pennsylvania at UPenn. And so just again, vaccines are not as experimental as people think, and trust that people who developed them were the first in line to get them because they were like, this is pretty, they believe that it was safe. This is not a situation in which others were being experimented on at the cost of someone else. These are, again, the investigators going first in line to say, give us the vaccine. So what is a vaccine, right? So think about it as a way by which someone can protect themselves from a disease. Now, sometimes you hear the term immunization, sometimes you hear vaccination, sometimes you hear the word inoculation. All of those mean the same. Now, immunity is what happens once you get vaccinated, or even after you get an infection. It is the actual protection that you get. And it can come from the disease itself. It can come from vaccination, called natural immunity or vaccine-induced immunity. Both are great. All right, both are good. Now, this is one key thing that people sometimes forget, is that vaccination, the goal of vaccination is to actually protect you from getting very sick from the disease and dying from it. It is not necessarily to prevent infection. It incidentally, does work pretty well in, protecting you from infection, but that's not what it's designed to do. It's designed to wake your body's immune, your memory, to learn how to fight it. So it's like saying, for those who've been in war, it's like a practice, simulation, right? You go out there in combat, you learn the moves, you learn how to target an enemy so that when you're actually facing the enemy, you have a shot of coming up ahead. I also think of it as an analogy of using seat belts, right? People say, we get a lot of criticism that, I got the shot, I still got the infection. Well, again, the vaccine it's great if it does decrease infection, but that's not what it's designed to do. Just like seat belts don't prevent accidents. You still wear a seat belt every time you get in a car, because driving a car is just as dangerous as almost anything else you can do. And a seatbelt won't prevent the accident, but it will prevent you or help decrease the chance of you getting really sick or getting such severe injuries that you end up dying or in the hospital. And so think of vaccines as the seat belts for your health. So what are the different vaccines that we have? We have, right now several vaccines that can really prevent infections. And the question is, the other thing I hear is like, what, why don't I just get the infection? What's the big deal? Well, right now, especially in this country, we don't see a lot of devastation from vaccine preventable diseases, at least not till now. But even in 2020, COVID, which is vaccine preventable now, killed so many people, more than several wars combined, and more enough that even an entire racial ethnic group, Black Americans, Black non-Hispanics, said life expectancy went down. So even when you think about what can we do to protect ourselves, and is it worth getting the disease versus getting the vaccine, there is no comparison. There is no no competition. You will survive better. Your rates of survival are always better with the vaccine than with and if you get the infection after you're vaccinated. So chickenpox, diphtheria, I don't know if you've heard about that, hepatitis, influenza, even the bacterial and the viral form of influenza, measles and mumps, these are all viruses. Pertussis, that's a bacteria that can cause whooping cough. Polio, I mentioned. Pneumonia, and this is the bacteria that actually causes pneumonia most commonly, but you can have a lot of other things causing pneumonia. Things that cause diarrhea, like rotavirus, and this causes diarrhea in children. And again, rubella and something called tetanus. So what are we doing here? So what do you, let's see. Why do you not want diphtheria? This is what diphtheria does. Diphtheria can kill babies, right? This is a child. You get a big, thick gray membrane in the back of your throat that blocks it up, and the baby cannot breathe anymore. And they call them bull's neck. The child has so much swelling in her neck that you cannot breathe. And you're literally choking the life of the child. So why risk that, right? When we have a vaccine that prevents it. And, I grew up in India. I've seen children who had diphtheria. It's not pretty. You would never want to risk it. What about polio? We're hearing about polio now. And as I said, we have people who stop vaccinating themselves from polio. This is what it can do if you get polio as a child. And it's devastating. People used to put children in what they call iron lungs, because the paralysis you get from polio can go into your chest and can stop you from breathing. And you need help to help those children start breathing if you have a very bad case of polio. Why don't we protect ourselves from it? This is tetanus or lockjaw. And, you also call it bowstring. Like, this is a child, you're grimacing in pain because your muscles are so taut from tetanus. And that you can get from getting cuts and scrapes from out in the dirt, because the bacteria lives out in the dirt. And you got to get your tetanus shot every 10 years. I get mine. And your muscles clench. And again, it can really cause devastating pain, and people can die from it. We don't see this anymore. And what we don't see, it's out of sight, out of mind. And because it's out of sight, out of mind, we become very complacent and stop taking it seriously enough till we get hit hard by pandemics, by things, monkeypox. Now we're seeing polio in people who haven't been vaccinated. And so, again, that isn't something we can avoid. So how do we avoid it, right? What are the different types of shots you need to get? So think about it. This is babies and pregnant women. So we're starting from your birth. The first few months, you're getting rotavirus. I have a 15-month-old baby, so I'm telling you, she got pretty much all her shots right now. Tetanus, DTaP is tetanus, pertussis, whooping cough, diphtheria. She got those. AHIB is like the bacteria form of flu, pneumonia, and polio. All kids, children, this is the inactivated polio vaccine. There is a live form of the vaccine that's not used in the US. And the reason you got to give these kids those vaccines is because when you're a child, when you're so young, your body hasn't learned to defend itself yet. So you need as much protection as you can to help your body, that baby's body, learn to fight off these infections if they face it, which is why some vaccines are not safe to give to a child in the first 6 months, which is why you see the flu shot, not the bacterial one, but the viral flu shot, the influenza, you get it only after the age of 6 months, as you do like the measles, mumps, rubella, the chickenpox, varicella, you get that after the age of 1 year, which is why it's important for the pregnant woman to get vaccinated. So pregnant women get the flu shot, so that even if the baby can't get the flu vaccine in the first 6 months, she's giving the baby the antibodies from her body, from the flu vaccine to the baby. And so the baby gets indirect protection from the vaccines a mom gives herself. And during pregnancy, tetanus is the vaccine that's also important that all women should get in the 3rd trimester, and that protects the baby too. The DTaP vaccine, not just tetanus, with diphtheria and pertussis. And women who are pregnant cannot get measles, mumps, rubella, but hopefully all the women are already vaccinated and protected, so their babies can get a little bit of those antibodies too when they're born for those first few months, so that they have some protection before they can get their own protection and get their own vaccine. So you can see, as you get older down the line, you start getting some measles, mumps, rubella. These are, you've heard of them as MMR, polio, pneumonia, varicella, chickenpox, and hepatitis. Hepatitis A. Hepatitis A, it's a virus, can hit your liver pretty hard and destroy your liver. And hepatitis B also is another kind of hepatitis, destroys your liver, but both, they spread differently. One spreads from blood and one spreads from food. Now you get older and you're thinking, okay, I haven't, you're saying since 78 years old, older kids, all the way till they're 18. What are a couple of things you think about in slightly older kids that you don't have to think in those first couple of years of their life? HPV. HPV, women and boys, all the rates of cancers from HPV were really skyrocketing till we got an HPV vaccine in place, and still we started screening women for PAPs. Now, if you think, oh, I've received my PAP smear. What's the PAP smear? It's basically a test for HPV to see, are you starting to experience changes that are going to turn into cancer? And HPV, we all got it. Like 90% of humanity gets HPV. We just have a good ability to clear it on our own. But when we don't clear it and you get little warts or it lingers, and some of the cancer producing types can cause cancer, oral cancers, penile cancers, cancer in the woman's genitals, like, we call it cervical, labial, vulvar cancer, all of those. And so when your child is started before, it works the best if you give it before your child becomes sexually active. So that's why they say give it, at 9 to 10, think about it. By 11 to 12, they should get it. So before your child becomes sexually active, you should get them the HPV vaccine. Meningitis vaccine, when they get a little older, especially when they're thinking about getting into college dorms, that's something that the children should have. And that protects you from getting a pretty deadly form of meningitis. What is meningitis? It's an infection that can inflame the brain, more like specifically the coverings of the brain, but it can cause a lot of inflammation and can really be very deadly too. So this one is dengue. We don't have dengue in the US, so we really don't need to get vaccines. And then the first time we're seeing chickenpox. So start your kids once they're getting older to get like the chickenpox vaccine. When you become an adult, after you turn 18, still all these vaccines are in play, and it tells you which vaccines become more important as you get older. And you can see once you hit 65, you should really be getting the two things. One is not the chickenpox vaccine, but the shingles vaccine. What's the difference? So chickenpox is when you get that first infection. The first time you get that infection and you get that rash, those spots all across your body. Now with so many people being vaccinated, we don't see it as commonly anymore. But what we've seen is shingles, right? When you get older, if you've had chickenpox as a child, chickenpox, like that virus, lives inside the body forever. And when you get older, your body's immune system, your defenses go down again. And when your body's defenses start weakening, that's when this virus starts getting activated. So let's say you're fighting a cold or you're fighting something else. You have, this virus starts breaking out, and it can be very painful. You get these painful blisters. So this zoster vaccine is actually to protect you from getting shingles. And that's when you get it after the age of 50, because that's when your immune system starts getting slowing down a bit and starts getting weaker. And you want to get the pneumonia vaccine too. That's one big thing for the elderly people, especially above the age of 65. So all of this information, it's not like you need to absorb all of this at one time, but you need to engage with the healthcare provider. And when they say, hey, it's time for you to get your HPV vaccine, it's time for you to get your shingles shot, it's time for you to get a pneumonia shot. They might even say, hey, it's time for your flu shot annually. That's when you got to say, okay, this is where it makes sense. And every 10 years you get a tetanus shot. Every 10 years you get your flu shot. Every year you get your flu shot. Now, there are some special situations that everyone has to think about, right? So the ACIP, this is the national body that thinks about what is safe and what's not safe for vaccinations. Think about, are there vaccines you shouldn't get when your immune system is weak? Like if you're pregnant, or say if you have HIV and your HIV is really severe, like it's out of control, then you don't want to get certain types of live vaccines. Now, what's a live vaccine? A live vaccine is a vaccine where you take either a virus or a bacteria, and you weaken it. You weaken it to the point that it cannot really actually cause the infection, but it is weak enough that it can remind your body how to fight it. Now, if you have no ability, if you have a normal immune system or a normal defense system, that's perfect. Live vaccines are the most potent, the most effective in reminding our bodies how to attack and kill these infections, more than killed vaccines. But if you have no defenses, like you are so severe, you're like immunosuppressed, then some live vaccines might go out of control and cause the infection itself. So it's only those conditions that you can see those red dots. So if you get the live influenza vaccine, which we don't use in the US, the MMR or the live chickenpox vaccine, that's when you want to wait till your body is no longer immunosuppressed, like you're in a better position. But you get most of the vaccines we have are really killed vaccines. So killed vaccines, they're not as aggressive in reminding your immune system how to fight off these infections, but they are pretty good in, there's no risk of you actually getting the infection from the vaccine. So people say, oh, I got the flu from the flu shot. The live vaccine flu shots are not used in the US. So there is no way you can even get the virus from the flu shot. But what you are experiencing is your body learning to fight the flu. So I tell my patients, if you got that sick from the killed vaccine, killed virus, think about what your body will do when it faces the live virus, right? So that's something you need to remember about how vaccines really work. So what about the COVID vaccine? So we know that one thing is like, our children are not getting as immunized as the adults. And that's really sad because, we're seeing like a large proportion of our population, the adults have gotten vaccinated. Why are we so worried about vaccinating the kids? Now, one thing people don't realize, they think the kids won't get sick from COVID, but I'm going to show you some information that actually shows that that's changing now. And children can get long COVID, or what they call long haulers or post-COVID syndrome, long term, just as much as adults. And of course, they can spread it just as easily, and vaccination can shut down a lot of that. So we thought kids are, safe from COVID. And that was true till vaccinations came into play. And now you have all the adults getting vaccinated. Kids' vaccinations were delayed. And so now you have all these children who are more vulnerable to COVID because they're not immune anymore, not vaccinated, than the adults who are vaccinated. And so what we started seeing, especially with Omicron, more than with Delta, that even though everyone thought Omicron's pretty mild, the kids are not really getting sick from it, they were 5 times more kids in the hospital with Omicron than with the version that came before it, which is Delta. And so this is something, and then I hear this from parents a lot. I'm like, my kid doesn't really have risk factors. Why should I get my kid vaccinated? It's only if my kid has asthma, right, that I need to get them vaccinated. But they looked at all the kids who ended up in the hospital with COVID. Almost like, again, over 40% of them they have had no underlying risk factors. So that means It's not like they had asthma or diabetes. These kids had nothing that would have said, oh, this kid would end up in the hospital. And so the only thing that really protects you then is the shot, the vaccine. The other big group, the second biggest group of the kids in the hospital after the ones who had no known condition, were the kids who had obesity. And, as parents, sometimes we have blinders on. We don't often think of our chubby kids are cute. But if they are a little too chubby, that also put them at a pretty high risk of ending up in the hospital. Now, the other thing we've seen in children is something called MISC, or multi-system inflammatory disease. And that's when children were starting to have multi-organ shutdown from COVID. And all of these, again, are preventable by vaccines. So what are the two vaccines we have right now for the kids, right? We have the Moderna and the Pfizer. And people are very worried about the Pfizer and the Moderna. It's like, is it really going to work for kids? So this is what they say. All you need to learn from this is that you can see the levels are pretty much the same in adults versus kids. So they saw the vaccine effectiveness to prevent infection, not to prevent severe illness, but infection was about 40%. So that's pretty low from the earlier ones that we said about, the vaccine, earlier when it first came out, the COVID vaccines were like 90% preventive against infection. But as the variants are learning from us and mutating, this is less effective. But here's the good news. It's really not about infection, right? Yeah. So if we get infected by COVID, but we don't even know we have it, we have a bit of a cold, what difference does it make? Is it going to send us to the hospital? It turns out these vaccines, even the ones that aren't Omicron specific boosters, are just as good at stopping you from getting to the hospital, or 85% effective against hospitalization. And this is something you need to remember. It's not the infection that you need to focus on. It's staying away or staying out of the hospital. And the same, this is the Pfizer vaccine. In blue, you see how it works against Delta. In pink, you see how it works against Omicron. And after the third dose of the Pfizer vaccine, which is why it's a 3-dose for children, it works great against Omicron too. So again, this is just saying it's about 80% effective, even against Omicron. So what do you worry about with the vaccination? Some of the common side effects are, you do get a pain in the arm. When I received my shot, I got 2 Modernas, and then I got my booster with Pfizer. And as far as, as I said, my kid's about 16 months old right now, and she's gotten her 2 Pfizer shots already, and she's still alive. So she's and normal. So if we are worried about is it worth it to have the vaccine, for me, those were the decisions that made a difference to say yes, even though I know that children may not necessarily get sick. The ones who end up in the hospital, we don't know why. So let's give her the vaccine. And so you get a little bit, again, of pain. You might get a little bit of irritability, especially when you're young. When you get older, the next day, especially the first 24 hours, you might get a lot more tiredness, muscle aches, chills. For example, after my second shot, I experienced a little bit of tiredness. Some people have a more severe reaction after the second shot. And the teenagers, male teenagers who got the Moderna had slightly higher risk of getting something called a heart inflammation called myocarditis. Now, this is the interesting thing, though. People were very worried about it, but the risk, viruses itself cause myocarditis. So the actual infection causes heart inflammation way more than the vaccine. The vaccine's about, say 1 in a million. The infection can cause it far more frequently than the vaccine causing that same effect. So what about boosters? And this is the important thing to remember. We're seeing that people are not really getting the boosters. They got their first shot, they got their second shot, but then they forgot about their booster. But you need to get it, especially if you're above the age of 65. Now, if you're above this age of 50, you're going to get 2. You qualify a second booster also if you have a weakened immune system. But if you live in, say, what they call long-term care, it's like a nursing home. If you live in those kinds of settings or an assisted living facility, you should get a vaccine or booster too. If you have some conditions that really weaken your immune system, you should get it. And if you work in a very high risk environment, you might be, again, eligible to get that booster too. So one thing to remember to reassure people is you can actually sign up for an app and directly let the CDC know if you're having any side effects after the vaccine. This is more than they've done for any other vaccine in the past. It's what should at least reassure you that it's safe. And all that information you turn in and your providers turn in when you complain about a vaccine, the side effect gets put into this database system called the VAERS, a Vaccine Adverse Reporting System. And it's not like everything on there has been verified. Some people say, I slipped and fell 2 days after I got the vaccine. Is it from the vaccine? They'll put that in there. They're like a number of falls after a vaccine, even if it's not confirmed. And for some cases, they'll go in and try to actually confirm if it was from the vaccine or not. So what does this mean for us, right? This is the challenge. Only about 7% of our children under 5 have gotten vaccinated yet. And where, as parents, we're again responsible for those decisions, they don't have the ability to make that decision for themselves. And the challenge is, we know that unfortunately, it's the people are split about where they're getting their child vaccinated. So you can see this is the issue. But here's a survey that says that those who parents are saying if the children's school is the one that says, hey, I think, you should get vaccinated, or makes it easy to get it, then that really works for them. And it makes a difference for parents to have an easy option to get their child vaccinated. And again, most parents also think that, they're worried. They're like, I don't have enough information. And hopefully some of the information I've showed you makes you feel a little more confident about getting the vaccine. But a lot of parents also worry. They're like, I don't know if it's safe. And again, as I say, this is not a situation where I'm going to recommend anything that I have not would not recommend for my own child or for my own family and for my family, for my friends. So this is something, as I said, it's important to be able to get this vaccine. And this, when we think about boosters, like, why are people not getting boosters? And it turns out that they are under this impression that they have enough protection from the initial vaccine, or they got COVID itself. They're like, hey, I survived COVID, I've had it, I don't need a booster. So this is where it gets a little tricky. So whether you've been vaccinated or you've had the natural infection over time, like with flu, that protection fades. Now, some infections, you get lifelong protection, but that's not true for COVID. That protection fades within a few months. And so it's really important to know that you having had the COVID infection before doesn't mean that the next time you get it, it'll be just as mild. It depends on the variant. If you have a more severe variant, you could have a more severe case the next time around. So this is, and again, this is why I feel, grateful that you guys are having me here and talk to you. When you look at whose information will people trust? They will definitely trust their own doctor or the child's pediatrician, but they will trust their employers or their health insurance companies more than they would trust the CDC or even the state government officials. And so don't see me as a state government officials, but I would say that go to a source that you trust. If you don't believe what's being told here to you today, check with your doctor, check with your pediatrician, check with your health insurance company if that's what it takes to get you the information that you need that'll make you feel safe. So in the last few minutes, let's talk about monkeypox, right? So monkeypox, we're calling it MPV now because, it's really, people think of, have very strange connotations when they hear that word. They're like, what's it really about? Now, it's not related to chickenpox, but it is related to smallpox, as I mentioned before. Same vaccine against smallpox works against. We found out about monkeypox decades ago, all right? But we didn't really have a lot of big outbreaks outside of West and Central Africa. Now, this is one of the first outbreaks that we've had that's really spreading outside across so many countries. especially in the US. And back before this, the last time we had an outbreak was almost 20 years ago, in 2003. And that was a very small outbreak. Only about 11 people got infected in Illinois, and it was from exposure to animals that actually had MPV. So what are the signs and symptoms? The first thing is you're going to get a little sick. It feels like a flu. Your lymph nodes, you might notice swelling up a little bit. Your glands swell up. And you can manifest the infection 20 up to 21 days from getting exposed. So if you got exposed to someone with monkeypox today, you're not in the clear till 3 weeks later. And once a few days after you start getting this, you might feel a little sick, a little tired, you start getting a rash. Now, right now in the current pandemic, it's a fairly common to not even know you've had a fever or anything of that sort. And the first thing you'll see is a rash. And because we're seeing it with people who have close contact, including sexual contact, you're seeing a lot of genital sores or genital bumps. And remember, can spread very close contact. Any contact with the scab, the skin, body fluids can spread it. You got to be careful about how you clean. If you have monkeypox or MPV and you're living with someone and you want to protect them from getting it. And it's very important that pregnant women not avoid getting monkeypox. It can spread to the baby. Right? Now, you start being contagious to others. Like you could spread monkeypox as soon as you start having symptoms, and that's important. So if you get sick, don't go to work. Don't, till you can get checked out to see what's going on. Unless you feel you can cover every single spot on the skin so that it won't really spread to others, then maybe you can go out and about. But otherwise, you really want to first get checked out. Go and get tested for monkeypox if you see some bumps that you think might be suspicious. And you can get from animals, but there's been only one case where a poor dog got it from the human, not the human, from any animal, at least with this outbreak. So what do you do once you get exposed? All right. The first thing you do is get the vaccine. So if you get the vaccine within 4 days of exposure, let's say you have a sexual encounter with someone who had monkeypox, or you were in close physical contact, skin to skin contact with someone who had monkeypox, on 3 days ago, get this vaccine within 4 days of that exposure. And that can actually prevent you from catching monkeypox. But if you get it within 2 weeks, even if you get monkeypox, you won't get very sick from it. So remember, if you get it really fast, you can maybe stop the infection in its tracks. But at least if you don't get the vaccine fast, you get it within 14 days. Even if you catch it, you won't get you won't have very bad symptoms. You won't get severely ill. Who else can get it besides those who've been exposed to someone? Well, we know among certain groups, like especially what we call GBMSNs, gay, bisexual, and men who have sex with men, they can also get vaccine, because we know that it's spreading very fast in that population, and the exposure may have occurred before without people even knowing it. So to halt this from spreading in its tracks, we really need to get them vaccinated as fast as possible. And the last group that can get the vaccine right now are those who are working in the lab with the actual virus and handling the virus sample specimens. They're the ones who can get the vaccine ahead of time. And I'm going to close with, this is a picture of Elvis getting his polio shot and doing his due diligence. I just want to say, I want you to really think about making sure that if you haven't been vaccinated for things you should be vaccinated for, that you start catching up with that vaccination. I'm going to stop sharing and I'll open it up for questions.
All right, thank you so much, Artie. I don't see anything yet on Facebook with any questions. Our viewer on Zoom, do you have any questions?
I do not have any questions. Oh,
You do
excuse me.
not?
Thank you. I do not.
Okay, okay,
I
okay,
do not have any questions.
okay. All right, thank you. And there's no questions here on Facebook. But I would like, let me see. I did have a question on the virus, on the COVID virus, where they were saying, some people would get the vaccination, but still turn around and get COVID. And some people have actually passed away after getting the virus and then getting the vaccination and then getting the virus. Can
Yeah,
you
and
help me on that?
yeah, and so that's a thing that comes up all the time, right? So the vaccine is really designed to protect you from getting very severely ill. It's not 100% though. So right now, if you look at the current variant, what we saw is that it's about 85% protective in stopping you from ending up in the hospital. 85% is not 100%, but I'll take 85%. Right. So unfortunately, the ones who ended up in the hospital, even after getting vaccinated and had a breakthrough infection, were the ones who usually had some really bad underlying conditions, like out of control medical conditions that weaken the immune system. And that's where we would see it more often than not. But this is an important thing to remember. Right now, vaccines are important, but there is COVID treatment out there too. So for those who don't know, even if you got vaccinated and you get the infection, go and get the treatment. There are pills out there you can get right now. It's only 5 days of pills that can protect you, but you got to get the pills early. You got to get it before you get sick enough to end up in the hospital. Once you get sick enough, those pills don't work. So you got to get it early, catch it early, get those medications, and that can protect you from getting to the hospital too.
Okay, and so then I do have one more question.
Yeah.
The other question is, I've heard people talk about, well, we don't know what's inside of the vaccination. And so, I mean, leery of taking it, with all of the experimental drugs and vaccination that they did years ago, and then coming up to it now, and the discussion that only the Black and Brown community are dying from the vaccination because of not knowing what's inside of it. And this is just conversation that I'm hearing. I'm completely vaccinated. I've had my booster. My son had his, and nothing. We both have been just fine. The worst thing ever happened was when I got my son vaccinated with the Johnson and Johnson. He did get sick the very next day, but he was, after I, Tylenol, hot cooling him off and all of that, he soon got well. So, and then we did our booster, and the only thing there was our shoulder where we got the vaccination pulled in. That was the only place. So can you answer that? Or
yeah, no, absolutely. And so, I want to say this is a different kind of technology. And when they say experimentation, this is not like, people are not getting experimented on from communities like minority communities of color the way they were during Tuskegee or during when they're talking about the Guatemala experiments. This is when one group of people is experimenting on another. Here, the people, if you could say, all the doctors, all the physicians lined up the first to get the vaccine. So does that, if that, so this is almost the opposite, and the communities that really would have benefited from it are so worried about whether this is good for them that they left themselves unprotected. So yes, Black and Brown people did die, especially Black people. But in 2020, when you look at the life expectancy, and the vaccine didn't really hit till November of 2020, the life expectancy of the entire Black race in the US went down from COVID. COVID has killed more Black people before the vaccine even hit. So if people are dying from the vaccine, I mentioned, the VAERS, list that in. And the question is, did they die from the vaccine or did they die from COVID? Were they up to date on the vaccine? Because if you didn't get boosted and you lost your immunity, the vaccine protection lasts only as long as it lasts. So then you might not have as potent of a protection if you didn't get yourself up to date. But the most important thing is, these are not 100%. So if you look at the one case that passed away, but you don't look at, say, Cassandra Taylor, who did okay, and you don't look at, I'm sure, President Obama, who did okay with the vaccine. Right. And so if you look at the one or two cases and you let that fear drive you, you will hurt yourself and you will hurt your community. And I would tell my patients that, I'm like, do this, don't just do this for yourself, do this for your community, because when you get it and you survive and you do okay, you are the best example that this works. Not someone like me saying, hey, this works, trust me, but get it so that you can protect yourself, and then by protecting yourself, you protect your community.
Okay, and then I have another question for you. Do you see the COVID vaccination being here just like the influenza, having, we got to get our flu shot every single year during a certain time of the year? And it's a two-part to that question. And if you do see us having to get the vaccination for COVID, how often or when do you see the time frame? Like for, flu season, when is going to be COVID season? Do you, in your professional opinion? And then please say again, for those that came in late, what your title is, so you're not just a random representative from IDPH.
Sure. And right now, so the first thing is, I do foresee COVID lasting a long time. Maybe we'll get lucky and it'll poof vanish, but it seems like it really will last for a long time. So we'll have to really line up for flu shots. We are seeing, while COVID simmers in the summer, just like some other viruses, but flu doesn't simmer in the summer, but COVID surges in the winter and the fall, like flu does. So if we get our shots, it'll most likely, along like flu, be around the fall when it's time. So I would suspect, based on that patterns, every surge we've had since 2020 has been in the fall, like the big cases, people in the hospitals really falling on, getting under a lot of strain. And I think the sad thing about COVID is that when the hospitals were full with people who had COVID, people who needed services for other things and didn't get those services. So we see a lot of deaths go up from heart disease, from strokes, from other conditions. Depression went up. So people, the mortality from a lot of other conditions besides COVID went up, and COVID went up. So I would see the time to get your annual shot is going to be similar to flu around the fall season.
Okay. So once again, what is your title for those that just came in?
Yes, I'm Aarti Barnes. I'm the medical director or the chief medical officer at IDPH.
Okay. All right. I can't think of any. I think I hit you with everything that I've heard in the past and present on this deadly virus, and now it's not as deadly as it was before. Oh, I know what it was. For those that really and truly do not want to get the virus, and it's all about your immune system, what would you suggest outside of the virus? I mean, I know it is because of you and I doing what we do and wanting to protect our family and our community. For those that really do not believe in getting the vaccination, how would they build up their immune system? What do you suggest for those that don't want to take the immunization, and for those of us who have done it to build up our immune system?
So one thing, wear a mask. Nothing works better than wearing a mask. So if you basically put a physical barrier from getting the virus into your system, having good vitamin D levels has also shown to help. It's not a, clincher, but it doesn't hurt. It'll just improve your overall health in general. So some of those things have really made an impact outside of getting vaccination. And if you do get COVID, don't forget there is treatment out there right now. So worst case scenario, within 5 days of you starting to get sick, you've got to get those pills inside you. If you wait longer than that, they don't work. So that's an important thing to remember.
Okay, now you said to get those pills inside of you. So now let's go to how can we get these pills and making appointments with your doctor. I know for me, and I'm not going to say what hospital, but make an appointment to try and go see the doctor is like, okay, well, I won't be available till a month from now. Well, I'm sick right now. So, and then the cost of it.
Yeah, and so the actual pills right now are still free from the government, so from the US government. So they're in every single drive-through Walgreens, every CVS. So they're present there. All you need is a prescription, right? And so there are now test to treat centers where if you go to a map, they're not everywhere, but a lot of them are in the Chicago area. We have about 146 test to treat centers in Illinois, and you can go there and say, I tested positive, it's my home test. We're trying to start up some telemedicine services where people, if you can't get in to see a doctor, you call and then someone can help you through that. But in the meantime, you need to just let your doctor know, you have COVID, you don't need to come into the clinic, your test turned positive. And even over the phone, the nurse can, the doctor can, or medical provider can call in a prescription for you. So you don't need to have a visit to get a prescription, and you need to remind your providers that you don't need to come in.
Okay. All right, that's good. I'm being the devil's advocate here and thinking of things that people have said and issues that they can come up with. And I just want to cover all bases as we possibly can. But I see we have met that our session on immunizations and monkeypox. And I thank you so much, but I have to do my little commercial. I got to do my little commercial. Okay, so our nonprofit organization is going to be hosting a camouflage comedy jam this Saturday at Countryside Holiday Inn. Tickets are on Eventbrite, or you can go to our website, www.topflightdefenseinc.org. 75 cents if you bring someone with you. 75 cents. Did I just say that? No, $75, because I don't want nobody coming out there. She said 75 cents. I got the recording. No, $75 if it's a couple for the both of you, and it's $50 for one of you. So that's my pitch. I want everybody to be out there, and we know laughter is good for the soul. We're going to laugh about some things. We have to laugh because there's a lot of things going on in this world that a lot of people are going through, and we need that mental break. So Saturday, take that mental break. And I appreciate you so much, Artie. I'm glad that we are now partners in crime. We're going to have you back on talking about other subjects. And I can't wait until next month when we talk about polycystic ovarian syndrome, PCOS. Hopefully we can get somebody from your organization to do the discussion. And until then, may God bless you and keep you, sending you a big heart. And I thank you for all that you do. Thank you, everyone on Facebook. Thank you, everyone that chimed in on Zoom. And
Thank you, Artie.